Okay. Yeah. So Matilda, we've gone through a few sessions. Have you had a chance of having a look at what was taught earlier?
Yes, I remember we had one session. I joined last Saturday,
Mm-hmm.
and then that was when we spoke about research,
Mm-hmm.
and then you were explaining to us types of research.
Yeah.
I remember we talked about quantitation
Yeah, exactly.
and qualitative research.
Yes. Yes, and then the two different approaches that we take for qualitative and quantitative research. Yes, exactly. So now this session actually talks about um, the third learning objective, which will be to identify and select a range of appropriate resources. So obviously, when you're doing your research, you need something that's done out there already in order to base your research on that. If there's no research done at all, you would then have no idea of where to go. So you don't know what gap lies there. So in order to identify where the gap is, you use certain resources, and that's what we will talk about. So this unit would aim, or this learning objective would aim to develop your ability to identify, select, and justify a range of appropriate sources or resources that are relevant to your research project within a given subject area. So whatever subject area you're working in. And this is not, as I said earlier also, this is not just for this unit. It is this knowledge should be there for you as a basis, so that you can just touch upon a little, like if you've not got a lot of statistical knowledge, you might do another short course on it. Or if you don't have if probably you don't have appropriate methods of referencing here, which are not so referencing is required, but it's not that rigorous. So just few references would be okay. That would suffice. But in a publication, so when you're publishing your data, you might want more resources. Then you could have probably a session on how to reference your research using different bibliographies. So so it remains lifetime with you for your lifetime. So this unit would involve teaching you how to critically assess and choose suitable sources. So if you're choosing one, why are you choosing that? Why are you not choosing the other one instead? And then to articulate the rationale behind your selections to ensure the integrity, relevance, and depth of your research. So how are you saying that this resource that you found, or the research that you're using, is it rigorous enough? Has it been peer reviewed or not? Has anyone else also had a look at it or not? So we are talking about all of this. So we'll talk about just a minute. Yeah. So the first step is to identify what your area, what you're working on. For instance, some colleague of yours mentioned working on sorry, dementia, for instance, on why does dementia happen now in younger age groups compared to when it happened in older age groups. So how do you identify and select proper resources or appropriate resources for your research project? So in order to ensure that you've had a comprehensive, so you've not left anything behind, and your investigation is robust, you're looking into the socio-economic disparities in healthcare access in the UK, for instance, if this is a research project, it is very important that you identify and you select a range of high quality sources from relevant subject areas. So the internet, it's available, but it gives you relevant stuff and also irrelevant stuff. So how do you pick all the relevant stuff that is of your use, and it's not something that, it's not just an extra piece of paper. No, it is something that is relevant, and it's something that, so what does your research do? It guides the others to do the same research in their area. So this is something that you could be proud of, that your research has been used by different researchers across the board. So these resources or these sources will provide you the necessary theoretical background, empirical evidence, and context for the research project. So what are the types of sources that we use? The different academic journals that we use. We use online or offline. We can use hard copies also of books or book chapters. For instance, if you take a book from the library or some other resource, or you've purchased a book, for instance, or any book that we've sent you online, you can use those. You can use government reports and statistics. So statistics is used a lot, and you use a lot of government statistics that's there online. You use certain non-government or organization reports. You use people's thesis or dissertations. Their projects are being published there. You use conference papers, or you use professional and practitioner journals. So they're different people, different guidelines on how to use them. So we would highly recommend that you use professional and practitioner journals. Conference papers, theses, and dissertations. These are the three things that could vary. So for instance, if you have a conference paper, it's a work in progress that has been published somewhere. But the work in progress at the end of the project is still in progress. It's not completed as yet. You probably don't have the results, or you just have the preliminary results. You would want to have the final results, and that is where you would go for professional journals instead of just a conference paper, which could have just a work in progress. Again, the same as for the thesis or dissertations. You could do it perfect. I could publish my thesis, which I'm doing right now, just in the middle of nowhere, and people can use it, but then you don't know if it's authentic enough or not. So yeah, academic journals are the best resources. So in academic journals, you have the Lancet, for instance. You have these are peer reviewed. So peer reviewed means that it's reviewed by several researchers. You have public health and social determinants of health. You have it gives you a broader understanding of health disparities and impact of socio-economic status of health. So in Lancet, you can use these. So for instance, you have this article by Mahmoud, which was published in 2005. It's on social determinants of health inequalities. If you're working on health inequalities, this is a very good journal to and a very good publication to access. Then you have the Journal of Public Health, which covers research on public health policy, practice research focusing on health inequalities and access to healthcare. And an example is the Social Determinants of Health, public health reports. Then you have Health Affairs, which focuses on health policy and research and provides insights into healthcare access, quality, and equity. You can use these resources, and you can use other resources. So it's just an example to show you what academic journals actually have. Then you have books and chapters within those books. So you have Social Determinants of Health, the Solid Facts. This provides a comprehensive overview of how these social determinants of health. So we talked about social determinants of health, what they are. So there may be your jobs that may determine your health, your income may determine your health, your race may determine your health, your geographic area where you're living, you're black or white, that may impact your health and your provision of health, actually. So these things have been researched a lot, and these things come with this author, Mahmoud, who's researched quite a bit in it. very thorough actually. And if you want to find out more, you can always use this book. Then there's Health Inequality, an introduction to theories, concepts, and methods. So these have been extremely important books when it comes to determinants of health, and seeing where the inequalities lie. So you would want to probably go through it and have an introduction of these theories, concepts, and methods. The links have been provided to you already. Then you have government reports and statistics. So you have Office for National Statistics, which provides official statistics on health and socioeconomic factors and healthcare access in the UK. So this is particularly for the UK. So if you want some other country, you would have to go for that. And it tells you the health state and life expectancies by national deprivation in deciles. So it gives you different percentages within England from 2016 to 18. Then you have the National Health Service Digital, which offers data on healthcare utilization, access, and outcome across different demographic groups. You have non-government organization reports, which includes the King's Fund. This provides research and analysis on health policy and healthcare provision within the UK. So this is to tackle multiple unhealthy risk factors and emerging lessons from practice. Then in these non-government organization reports, you also have Health Foundation. And this focuses on health improvements and healthcare quality and offers insights to health inequalities. So a lot of times we've talked about health inequalities. The reason why we talk about health inequalities is that it's a subject that is quite in debate nowadays. It has been in debate for a very long time, but it's only now that this data that we have is actually making a difference now. So people are working on those health inequalities and working to remove those inequalities as best as they can. Then you have certain thesis presentations, conference presentations. They offer detailed and focused research on certain specific aspects of socioeconomic disparities and healthcare access, and they provide in-depth case studies and theoretical exploration. So you could use these, or you could say that, no, I'm not using this because this does not have the complete results. So this is the last that we would want you to do to access. The first should be always journals and articles. So to see the socioeconomic status and healthcare access in urban areas of the UK, it was a PhD dissertation. So it's the University of Manchester that used it. Then you have conference papers where they present cutting edge research and emerging trends in public health. You have different conference papers. So you just type in your title and you'll have conference papers on Google also. You have, for instance, the annual public health conference. That's by the Faculty of Public Health. That has their reports there as well. And then you have professional and practitioner journals. I've mentioned Lancet. Then you have British Medical Journal, which would obviously again be for Britain only. So it publishes research and commentaries on clinical practice, public health and healthcare policy. Because it's a medical journal, it will have more of this. An example of this is by Mahmut again, where he sees the Fair Society, Healthy Lives, the Mahmut Review. This is highly recommended. Even if you want to see it in another country, it's a very good structured journal or article that gives you evidence of inequalities. So it might not just be the UK, it might be in health inequalities that exist anywhere else. So let's say your gender, or let's say your socioeconomic status would make you deprived of certain health, you would experience certain health inequalities because of your socioeconomic status. So this is a known fact. This has been researched extensively. So Mahmut just gives you a basis to work on and gives you a clear picture of what you would expect in any other country also. And then you have community practitioner. This is very relevant, where it focuses on practice-based evidence and insights from community health workers and practitioners. An example of this is by Smith L. So I'm giving these references because you would have to reference your articles as well in this way. We'll talk in more detail about this referencing in our next session tomorrow. So here he addresses health inequalities and in a community practitioner's perspective. So that's the journal's name, Community Practitioner. And for British Medical Journal, it's here, BMJ. So this gives you the last name and the first name's initial of a journal, and then you have the year, you have the title of the journal or the article, and later on you have the page numbers and the volume actually. This is for the journal. So this is a Harvard referencing style. So we would recommend that you also follow this style. And then justification. How do you justify selected resources? So if you have selected a certain number of resources that, okay, this is where I would want to focus my research. If it's academic journals, they would provide you peer-reviewed, high-quality research. And an example I've shared with you is Lancet, a journal of public health. They're very renowned for their contributions to public health research. Then you have books and book chapters. They offer comprehensive overviews, theoretical frameworks, and they are crucial for understanding the broader context of socioeconomic disparities in health. Then you have government reports, statistics, which then show you numbers. Statistics show you numbers of health and inequalities or socioeconomic factors, whatever you want to see. So these reports provide you with that data. And then you have NGO reports, where you have the King's Fund and the Health Foundation produce insightful reports that analyze health policies and practices and offer practical recommendations for addressing health inequalities. When you use theses and dissertations, they provide you detailed case studies and theoretical explorations that would be beneficial for in-depth analysis. I've not said that you don't use it, but I would recommend that you use the other professional journals instead of first using this. So if you don't have any information on those journals, which is very highly unlikely, you could then recommend these could then be your next resort. And then you have conference papers. So they offer the latest research findings and emerging trends, and they ensure that the study remains current and relevant. You have professional and practitioner journals. We've talked about these. So when you're utilizing a diverse range of resources, your research project will be highly it will have high rigor and high quality. It will be very relevant. It will be abreast with latest information, and that information will not be outdated. You will have comprehensive evidence, and you will ensure a thorough investigation into the impact of, for instance, socioeconomic status on healthcare access in the UK, which is our objective. Okay, so where were we? Yes, we've talked about all of these. So if I want you to justify, so if you've used, for instance, any resource within your project, how would you justify? Why have you used this source, and why have you not used another resource? So this is one of our objectives also, to assess that you've used the proper resources, and you've excluded all the resources that you would not want to use, and you would provide a justification for that. So to ensure a thorough and comprehensive investigation into the impact of, for instance, socioeconomic status on access to healthcare services in the UK, it is very important that you draw from a diverse range of high quality sources. So it's not just one resource that you're using. You might use NGO reports, you might want to use statistics from any government report, you want to use journals and articles from another one. So each type of resource selected for this research would provide unique value, and that would contribute to a holistic understanding of the issue. So you have these justifications. So for instance, if you want to use academic journals, they give you current research. They're peer reviewed. As I said, they have been reviewed by several other researchers so that they ensure that the research is of high quality and credibility. When you go through this rigorous process of peer reviewing, that means that you have taken into consideration the opinions of other experts also. And then there's current research, where journals publish the latest research findings, which is crucial for staying up to date with recent developments and trends in public health and healthcare disparities. It gives you a depth of analysis. So it doesn't talk just about superficial things. So the introduction, if you go into the introduction of a journal or an article, it will give you a lot of detail. And then the discussion in itself, it gives you so much more detail on so many aspects that you want to research. So for instance, you have Marmot's reviews in the Lancet, or you have Raymond's review on public health reports. Then you have books and chapters. So why do you want to use these? You have they give you a comprehensive coverage. So an article may be worth 8 pages, but a book obviously is going to be more extensive, and a book is actually produced based on these articles. So a book would have references, and most of these references have been taken from several other books or several other articles and journals. So they provide you a broad and detailed exploration of topics, offer you a theoretical foundation and historical context that are vital for understanding complex issues like health inequalities. Then you have theoretical frameworks, where books often discuss various theoretical frameworks which are essential for framing your research and interpret findings. So you have Marmot's books again, where you have social determinants of health. You have online access to these books also if you want to use for your research. You have Bartley, which was published in 2016, which shows you again health inequality, an introduction to theories, concepts, and methods. So it's a policy press article. Then you have government reports. So why would you want government reports? So these give you access to data. So sometimes you might not have access to data online anywhere else, but on government reports and statistics. So you would want to use these in particular, like Office of National Statistics and NHS Digital. Then you have national scope. So these sources provide comprehensive data at a national level, which is crucial for understanding the broader context of healthcare access and socioeconomic disparities in the UK. They give you policy insight. So if you want things on policy, you would want definitely to go to these government reports and statistics. So they give you reports based on certain policies, and then they would give you recommendations also. So for instance, you have NHS Digital, you have the ONS also, so their latest. Then you have certain NGO reports. Why do you want to use them? Because they give you work that has been done outside. They are published, and they are non-government organizations. They work hand in hand with the government, and they give you certain other perspectives that maybe real life experiences and challenges which are not published in articles or journals. So if you want to go for these, you would get all this raw data there. Advocacy and innovation is also provided by them. So NGOs often advocate for policy changes and innovative solutions, offering valuable perspectives on potential interventions in order to address health disparities. And you have the King's Fund and Health Foundation, which are again very latest researches or non-government reports, which you would want to access if you want the data from them. And why would you want to use thesis and dissertations. So they give you in-depth case studies, where they would provide you detailed case studies and focused research on specific aspects of health disparities, and they would offer valuable depth and specificity. You would get original research at times. So these sources often present original research. Original research is the research that you are doing. For instance, you're not using secondary data. You're actually conducting a research study and taking actual data. For an instance, this is Smith J. So this is a PhD dissertation from the University of Manchester. When it's published online, you can actually use it for your resources also. And then you have conference papers, which give you cutting edge research. So they're very emerging trends that you might not find in publications, which take a long time. By that time, the trends might disappear. So for instance, you would have more of COVID-19, which is rising again in a conference paper instead of in an article, in a journal article, because the journal article would take a whole year to be published, and then that data becomes outdated. So conference papers are used in order to have recent data. Access to recent data. And then you have professional networks, where conferences provide opportunities for networking with researchers and practitioners, facilitating the exchange of ideas and collaboration. So you have annual public health conference by the Faculty of Public Health, for instance. And then the last is use of professional and practitioner journals. As I said, it's evidence-based. It gives you rigorous peer-reviewed access to rigorous peer-reviewed opinions. So they're experts who are peer-reviewed. They're your peers, but they're experts in the field. So they go through your whole journals and your whole article, and they give recommendations whether it should be published or not. So you would expect it to be of very high quality, and it gives you practice-based evidence. So whatever has been practiced, that evidence is there out in for you to use it. So the selection of these diverse resources, we've talked about a number of resources. They're justified by their ability to provide you with comprehensive, credible, and relevant information. So if you want to use, we would want to see other articles, other journals also in your research, but we would highly recommend that you would get a lot of details if you use these resources that have been mentioned. If you don't worry, you will not be penalized for it. So it's up to you. These are just an example of what you could do. So when you integrate empirical data, you integrate your theoretical frameworks, which have been published by Marmot, for instance, practical insights and current research, your study will be well equipped to address the research questions that you have and contribute valuable knowledge to the field of health and social care. So this is an approach which is multifaceted, and it ensures that your research is very strong. It's research. Your research is evidence-based. It's well-rounded, and it has high-quality evidence from several perspectives. So these are some of the references that you would want to access. Therefore, different articles that we've discussed in our session today. There's further reading for you, and we'll have our last discussion tomorrow, which will be the assignment discussion. And 2 weeks after that, you would be expected to submit your work for your project for review by us. Yeah. Is there any question? I know we finished a bit early today, but please let me know if there are any questions. I'm happy to answer them. Tomorrow we will have a detailed discussion on how to go about with your assignment. We had a discussion that was not very detailed initially, but tomorrow will be the day. If you have other colleagues, please let them know. The class will be the same time, 10 o'clock. Tomorrow, the Zoom link will be shared with you. It's already shared with you, but I'll share it with you again 10 minutes prior to the class. And I hope to see you also there.
Hello.
Yeah.
Please, I wanted to find out, in a research when given,
Mm-hmm.
can all the sources can use in a best use all the sources so whatever I'm talking about this determines what kind of source I use for, or is it plagiarism?
Matilda, so I'm so sorry. I don't understand what you're saying. Your voice wasn't clear. Sorry.
Okay, so I was asking that in a research, okay, when you are given a research to undertake, can you use almost all the sources or like more than 3 sources in a particular research, or is it wrong to do that? And then
It
if you are
depends.
using
Yeah,
a
it depends
research,
upon you. I'm stopping recording. So it's completely dependent on you. If you want to use several resources, it's up to you. If you don't want to use several resources, you want to stick to one. So we would recommend that you use several resources. The reason being that I'll just stop sharing this if that's okay. So the reason being, if you're using several resources,